you so much for coming. I'm State Senator Karin Housley, and here with my group and Senator Abeler and Senator Aki, we have before the committee yesterday the long-term care rescue package. We've all heard, and you've heard me in my Aging and Long-Term Care Committee over the last 2 years talk about the crisis that we are in. Our long-term care facilities, our assisted livings, our nursing homes have been just decimated by COVID, and we are in a real crisis. They were in a crisis even before COVID. They were down 9,000 employees, open vacancies for those folks to help take care of our most vulnerable. Now there are 23,000 vacancies, and our facilities, our assisted living homes, are struggling to find people to come and work to help take care of these folks, and they're having a hard time retaining these folks also. So what this bill will do, we have retention bonuses for those folks that have already been working in the long-term care facility. They will, from PCAs to nurses to hospice cares, palliative care folks, $1,000 retention bonuses for those folks. Then we will have hiring bonuses, $1,500 for those folks who are interested in going into this wonderful caring line of work. $750 upon hiring after they've worked there for 30 days, and then another $750 5 months later. And then to also help out with their training and their uniforms, there is another $1,500 per person to help take care of their education, training, and work attire. The whole package comes to $265,000 for the PACE program is also in here, and that's a bill that we heard last year in committee to help our seniors stay in their home longer by coordinating their care and making things more streamlined and a lot simpler. So the whole bill is 260? It changed. 322. $322 million we will be infiltrating to help hire and retain long-term caregivers and help our assisted living and our nursing homes. So with that, I'm going to toss it to Senator Utke to talk about his provisions in the bill. Thank you.
Thank you, Senator Housley, and good morning. I'll just add a couple more things. Senator Housley did a good job of explaining kind of what we're up against, because the topic of today is just the shortage of labor in our group homes, day services, et cetera, our providers. As we all know, if we have to wait an extra day or two for a car, it's an inconvenience if we're getting it repaired or whatever it may need. With the people that we're serving here, our group homes serve human beings. And when we're serving people, we don't have a day or two to wait. If nobody's at the facility, we now have a crisis on our hand. And that's what a lot of our providers have right now. The crisis is either on the doorstep or in some cases it already has arrived. They're having to close facilities, and that's just not something we can deal with. This legislation will help our providers. We want them to continue to serve the Minnesotans that they are, and will need their services here in the future. We know the labor pool is small. There isn't just a magical labor pool that's going to drive up to the door and they'll unload a bus full of new employees. So we have to incentivize and recruit new people. And again, you know, I guess the caption or the headline of the day is recruit and retain. And that's what it's all about. We've got to get people into these facilities. One more piece of the bill is what affects our day services and our home providers, and that is that we're moving up the funding that was appropriated previously, but that funding will be moved up to April of this year. Again, trying to put more money into their hands so that they can recruit and retain those employees that they need to serve the Minnesotans that they're there to help. So with that, Senator Abeler. Or no? Oh, sorry about that.
Hi, I'm Christina Kirshner from Mount Olivet Rolling Acres. It's Christina with a C, and Kirshner is K-U-R-S-C-H-N-E-R. I run the respite site for Mount Olivet Rolling Acres. It gives parents a break from the everyday cares of taking care of an individual with disabilities. In 2014, I decided to take 2 jobs in direct care for a total of 60 hours a week because I love direct care. I love what I do. And I could sort of afford my bills if I worked that much. But then in 2015, I became a mom, and not only did I think it was unfair to my daughter to work that much, but my income wouldn't cover daycare. So I took some time off from the field, and in 2019, I found a job at Mount Olivet Rolling Acres running their respite program. So in May of 2020, we were asked to shut our doors because of COVID. And as with many businesses, there were several people in our company that decided to take an extended leave of absence during COVID, and there were also some that opted for an early retirement. When we had COVID positive people in a home, we had another wave of people that would leave because they were uncomfortable working with individuals with COVID. And then on top of that, any staff that were positive or exposed were also asked to take time off. Often this left me, because I was helping out in these homes, with just a couple of other staff that were able to work. I worked long hours. I sometimes brought individuals to the hospital or cared for them while they were on hospice. It was not easy, and the whole time I knew that these people would rather be with staff that they knew and trusted and staff that knew them. Unfortunately, things have only taken a turn for the worse as far as staffing goes. The stress of this last year and a half has left its toll. Our company is really struggling. We have 80 full-time positions open. The respite program closed again in early December due to our company's inability to staff our group homes. We also had to shut the doors of some of our other group homes and ask people who are living in these houses to go other places, sometimes back to their house, sometimes they were moved to a different home. As a supervisor, I struggle with holding people to high standards right now. Can I really mention that someone was late when I know they're under a lot of stress like everyone and could easily make more money doing a manufacturing job? We are struggling with ethical questions. Can I really approve 70 hours per week when I know that the staff isn't really going to bother to do anything with the clients above the bare minimum? Should I pick up an extra shift, or is 52 hours enough? After all, I do have a 6-year-old daughter to raise. Can I really give these people the care that they deserve after working 50 hours a week? In early January, I worked over 78 hours in a week. I was supposed to be supervising a home, but almost every one of those hours was spent in direct care. I had another coworker who worked 79.5 hours and another one that worked 60 hours that same week. It's not healthy and it's not sustainable. And when you call your 6-year-old to say goodnight, because you can't be with her, and you can tell she's crying because she misses you that much, it's too much. A lot of great people, great supervisors and other people in leadership have had it and they've left. And when they leave, they are not coming back. That's why it's so important that we help as soon as possible. If I make one point today, I want you to hear this. We are really struggling to find good staff. And when those good people leave because they have had enough, they are not coming back. We're doing irreparable harm to this industry. So every day that we wait is a day someone quits and never comes back.
Hello, my name is Kurt Rutsen, Kurtrutzen. I'm a disability advocate, and I wanted just to say what my team has said, and we are in dire need of staff. I don't, I was thinking driving here, and I was pondering, and I talked to other folks. You guys, if we don't care, let's say as a state, we don't care about those people. Let's let them go and let them die. I think we all got ourselves up this morning. I know I even did. But you guys, there are folks that can't, who are still out there laying in bed. His staff didn't show up. They took another job. And I just want to challenge you to think about that, being the front of your mind, because that's the reality. This isn't some game that we're trying to, let's just extra. No. I wish that would be a dream of mine. But in ending, I want to re-emphasize again that if we don't care, let's just say it and put it on the table and do other stuff. Let's just say it. Let's be honest. Thank you so much for your time.
That was amazing. Amazing. Minnesota cares about the people with disabilities. We care about our seniors. We care about the fragile people who cannot get out of bed by themselves. This is not a partisan matter. There's been efforts by the governor and by others to try to make a difference about this. But it's time to really get kind of serious about it. And we have to focus on this. This is the worst time ever in the history of Minnesota for people who need to be cared for. We've never had nursing homes closing like they're closing, and they're closing. We've never had group homes where 4 people live that are closing and hoping they can find someplace else to send these folks. Group homes, oh, that sounds like a group home, great. Some of these people in group homes have tracheostomies that have to be tended to every 5 to 30 minutes or they will die. These are not minor cases that people have just need someplace to live. We have parents who are 78, they're now part-time caring for their kids who are 53. And they're almost unable to do it. And this is the crisis. And so we have come forward with $322 million out of general fund to say, can we begin to stabilize the industry, get some more people into it, and then try to reform it so that we can actually have a system that works. This is the beginning, it's not the end. And so there's 206,000 people we're attempting to get $1,000 bonuses to in nursing homes, assisted livings, hospice, palliative care, home care, group homes, day services, to please, would you please stay? If they stay for 6 months, here's $1,000. I wish it could be more, but $1,000 for 206,000 people costs $206 million. So it is big money, but we care. Minnesota cares. And so the governor's put forward a plan for $115 million, which will do an undefined effort, but he's in the game trying. The House, I'm sure, is interested in doing some things as well, but it's time for us to work together, and we're taking the lead in the Senate in a bipartisan way about passing this bill. The bill passed my committee, our committee, with very strong bipartisan support. And so we must. The numbers actually work. It will make a difference. And then we have to discuss further how we handle the stabilized industry long term to keep people working so that people like Christina can actually afford to work there. So here we are. And I think we should take Kurt's challenge. Do we care? I'm telling you, I believe Minnesota cares. And we're here to lead the way. So thank you. So we'll take questions.
I have a technical question first. It reads to me that this is one-time money, the way you're proposing it? It's
Correct.
not ongoing money?
It's one time.
Okay, so sort of out of surplus?
Yes, one time out of the surplus.
And then a different question maybe for Christine is, can you give us some idea what the demographic of the workforce in this industry is? When my mom had assisted care, was a senior citizen who was working some hours. Are they immigrants? Are they Who are
We
these
do
folks?
employ a lot of individuals that are from other countries, at least where I work, and I think that's true of nursing homes too, but I don't work for a nursing home. We have tried to attract older people who are maybe like semi-retired. We haven't had a lot of luck for that in our company, but I think maybe like for PCA work, some people who are semi-retired will do things like that, so. Does that answer your question?
Yeah, kind of, because I'm just wondering who is potentially out there who would respond to the bonuses or hiring bonuses like this? What's your world of possible candidates?
Well, I think that these bonuses that we're talking about are just more to entice people that are already there, so.
Any of the senators have a thought as to who your target is for these kinds of bonuses and hiring? I mean, are they out there? We were talking about the same thing for police. We're talking about all sorts of staffing issues in the state. And each time, everyone wonders whether there are people out there who are willing to fill these jobs.
Well, and we hope there are. And so this is an ambitious goal to hire 20,000 people, to entice 20,000 people in. It's 20 hours or more a week, so you don't have to work full time. So a college student, one of my son's best friends, is a CNA, and he loves the work. And so, but it's a matter of hoping they'll be drawn in. But without something like this, they're not coming. And so at least if the training can be free, some places they've had to pay for their own training. So, and the training costs, the governor's program, it costs $1,300 to train a CNA and buy their uniform and a book. So we have $1,500, which can cover the background study and a few other, details about that. But this is the beginning of an effort. And $322 million sounds like a lot, but it's barely a good start. But it's the effort to create, to make sure that we get more of her hanging in there, and to welcome them in.
Yeah, I just want to comment to if I may, let's not pretend, you guys, that when they're doing this work, and it's so important work, they look over and see McDonald's. Nothing against McDonald's or Aldi's, but that they're offering $22 plus an hour, and they don't have to. They get lesser responsibility. You guys, I know, and I thought, well, maybe I can do it and just take. But I know I can't. The lifting and the remembering the medication and everything is a tough job. But it's worth job, very worth it. And to take care of people that need it. They don't necessarily want it, but they need it. So that's my comment.
Can you discuss how this might fit with hero pay? Would these folks also be eligible for any kind of hero pay checks?
The hero pay, I was the chair of that committee, and you know how many times we met last summer and fall. That is separate from this. We can still do hero pay in a separate negotiation, separate bill. This is just specifically for this industry of caregivers to help retain who's already there. So it's not a bonus for having worked, it's just a bonus to help retain them, and then a bonus to hire and help pay for training. So it's completely separate from the hero pay.
But they could get both.
Oh, yes,
So this is not
absolutely.
exclusive, so.
Yeah, they
that
could get-
We hope that can get sorted out. That's still in
Yep.
negotiations. There's all kinds of good intent about that, so.
Yep.
But this is all looking forward, that's looking back.
Senator Abeler, can you talk about, I mean, you mentioned that this is one-time money. I'm wondering, if you think that a one-time bonus of $2,000 is enough for somebody thinking long game, if you're trying to keep people around, isn't it a bigger question about wages being more sustainable or something like that? That's what I had been hearing from some staff, that, they're not paid enough for the how hard that work is. And so they, to the point about McDonald's, why wouldn't you go somewhere else?
Well, you've asked the old $64 question. That is true. But if we don't, first, the industry is in crisis. There's no crisis like has ever been like this in the industry, where people are literally going to expire because they couldn't get care. The people that can't get out of bed, there are people who have died from not having staff. Their staff took a weekend off. The guy said, "Oh, I'm good to go," and the new staffer never came. And they found him on Monday. And there's going to be more stories like that, which are catastrophic. So first we have to stabilize the industry. We hope $1,000 will give people an incentive so they'll know we care about their caring. And then we want to try to draw in 20,000 new workers with this incentive. Is it big enough? Will it work? The money is there. The governor had a goal of having 1,000. And so a handful have gotten through the program, 800 or so were there. There's some marketing money left over from that. This is an effort to collaborate and to draw everybody into the topic. So this is going to be a statewide effort. If it's successful, it's going to be because the governor decides to weigh back in, because the House decides to cooperate with us. Otherwise, we're having a nice press conference. But we're insistent on that. And we're putting a significant amount of money, $1/3 of $1 billion, into this effort to make a stop, make a difference. And so retain, try to hire some new people. And then the PACE program, which didn't get mentioned very much, is actually a way to wrap around services to seniors in a way that might actually help them have a more consistent programming throughout. And so long-term, we have to talk about pay, but we also have to talk about how can we make the workforce be more effective? How can I make Christina and her friends be able to serve more people? Are the ratios correct? How about overnight monitoring? How about technology? How about shared services? We're having that hearing starting today. And so this is the beginning. The middle part is how do we make the workforce go further, and how do we make this a positive career? And welcome to the dilemma, welcome to the discussion, and the Senate is committed toward all of that.
You touched on this a little bit, but can you talk about the timeline here? How soon are folks being pulled out of nursing homes or group homes, as far as the National Guard or some of the more temporary folks? And how quickly can you get some of these new recruits on the ground?
The National Guard is almost done. They were doing 3-week stints, and it was a modest number of guards, and they filled a gap. Thank goodness that COVID is kind of waning, and so the hospital beds are less in demand. And so the problem was they were stacked up in the hospital. There were no nursing home beds to go to for rehab. And so that's a challenge anyway. Given the nursing home crisis and these other off-site places, they're still backed up. But the point of the way the money is going to get spent, it's going to get sent right to the provider. There's not going to be a 3-month process of checks going out or whatever. The goal is to get it to the provider. We would take a census on March 1st about how many people are working somewhere, and then come August, they would tell us how many people have worked 20 hours or more a week, and then the money would go out and they would get a check. The same thing with the hiring and training bonuses. We want to get right to the providers. The $55 million there was a 9% increase to a lot of these places on January 1st. Some aren't getting it until December. And a lot of them are digging deep into their reserves and stuff to try to get it to go. So we wanted to move that up to April 1st. That costs $55 million. And that'll help them do their own efforts. But this is one way to start. But the industry is trying to react. They're digging into their reserves. But when it collapses, what's going to happen? And we just don't want to stand by and see that.
I see that the hiring bonus is like distributed in 2 parts, probably so somebody doesn't take the bonus and run. Yeah. But is there any term for an agreement? You say, I'm going to take this bonus. Yes, you get half of it after 6 months, but is there a term saying you have to work here for like a contract kind of to ensure people stick around and kind of meet the goal that you're hoping for?
No. We're trying to get people to walk in the door. And so if they want to come and work a month, then thanks for being there for a month. And I would have to say that a lot of providers are happy for the month. They'll be happy for the 6. And you yourself identified that it's a small amount of money. We want it to be a number that would make some sense to people, that maybe they would be enticed by that, to choose. And what happens in the industry, Christina can tell you about her peers. I've been talking about this for 2 decades. The people that serve are true humanitarians. They love their clients. They get involved. They become part of the family. These group homes, it's like 4 people or 1 person. They become, that's who they socialize with. And they truly have joined into that. And we hope that when people get a flavor of that kind of a job, compared to some other tasks that's more meaningful, they go like, I love this work. I love the individuals, and I want to make a difference. And so we're hoping to tap into that as well, so they can at least try it out. And maybe they'll get a regular job, and then they'll work part-time doing this. That'd be great, too. Thank you.
Thanks.
Christina, sorry, really quickly, can you just talk about what this bonus would mean for you or for your colleagues?
Sure. I think that it's really important to recognize what we've been going through, and I think that that would mean a lot to have that money. I mean, we live in a capitalist society, so money talks, and I think that that would do a lot to keep people there if they're getting it over the 6 months or whatever. So I think that that would be great. I do think that we need to look at the rates that we're paying and have better long-term solutions, but we're trying to react to what's going on now and get money out there as soon as possible. So that would be a huge benefit, and every little bit counts. So.
Thanks.
Thanks.